paramedics in the province have been without a collective agreement since April of 2020. And according to our next guest, the conditions that led them to going on strike have been getting worse, not better. Here to tell us more about this tricky situation is Hal Newman. He is a former paramedic and firefighter with more than 4 decades of experience in emergency health services, now writes for the Rover. Hal, welcome back to the show. I've been following your writing with great interest. Welcome back.
Hey, thank you for having me, Elias.
Just first things first, in my intro here, I mentioned that paramedics have been without a collective agreement since April of 2020. How far is that that labor strife gone at this point?
So they haven't been with. The situation's so nuanced. There are so many questions to ask ourselves. One that's been particularly troubling for me of late is, why is the government negotiating with the employees of private ambulance companies? I'm a little bit confused on that one. I'm trying to think of the last time that the government actually negotiated with the staff of private companies. There's only Urgence Santé that's owned by the government. Mm-hmm. So I'm at a loss as to understand why the paramedics for Urgence Santé don't have a new contract, seeing as they actually work for the government. And I'm at a loss to explain why all the other paramedics in the province are dependent on the government to negotiate their contract.
And so right now for Urgence Santé, is it a sort of work to rule that's going on right now? Would it be defined as a strike? How would we call it?
So it's defined as a strike, but it's a strike, and it's an administrative strike only.
Yeah. Okay.
The reality is, and they do have some of their management take the place of the paramedics 4 hours a week. So symbolically, the paramedics have a strike of time, but the reality is, you're a paramedic, you're an essential service. So they're not on strike in terms of affecting patient care.
Yeah.
They remain completely dedicated and steadfast. The conditions are absolutely brutal of late, and I don't know if you've been tracking my Twitter feed, but just in Montreal and Laval, Urgence Santé's call volume is through the roof. And they just don't have the number of paramedics that they need to respond to all of the calls. There are enormous delays on lower priority calls. And even on some of the critical emergencies, there have been some pretty exceptional delays. Mm-hmm. I heard that last Friday there was a cardiac arrest in Pointe-aux-Trembles. The closest ambulance was dispatched from Côte-Vertu, from Saint Laurent.
Wow.
20-something minute response time. Yes, the first responders from the Montreal Fire Service were there in 5 minutes, mm-hmm. but that's a long time to wait for paramedics. So they're just getting slammed. And yesterday, the Urgence Santé paramedics, it was a level 1, level 2 emergency all day, so that their lunch breaks were curtailed. So they're working call after call after call, no meal breaks.
Mm-hmm.
Yeah.
Well, Hal, listen, I've been following your Twitter. I've been following your reporting and writing on the Rover here. Is it the COVID-19 situation that is exacerbating the problem? Are there paramedics, a large number of paramedics out sick on top of everything else?
I don't have the exact numbers. I would guess it's probably about 20%, because that's the number I hear across the province in terms of paramedics affected by COVID. I think we're in a perfect storm, pardon the expression. We're well into the pandemic, 2 years later. The volume of calls is very high. The stress level is very high. The mental stress is extreme. And I think people are burnt. And so I think that their absentee rates are much higher than they were pre-pandemic. And sure, the labor strife doesn't help. Mm-hmm. It's yet another factor. And of course, the way our system is set up, the ERs are the gateway to our healthcare system. And if you call for an ambulance and you need to go to the hospital or you want to go to the hospital, the paramedics have no choice but to take you to an ER, and the ERs are all overloaded. So then the paramedics with their patients have to wait for to be triaged, and then they have to wait for a bed to become available. So yesterday in Joliet there were 10 ambulances and their crews and their patients waiting to be transferred to beds in the ER. So the whole system, it's a series of cascading effects, right? So you have a limited number of paramedics, a high call volume. They're going to overloaded ERs, and the ER staff are dealing with the same issue. And then there aren't places in the hospitals, and so the system is broken down at this point.
We're with Hal Newman, former paramedic and firefighter, more than 4 decades of experience in emergency health services. Now writes for the Rover and has been keeping track of the situation with paramedics in Quebec through his writing and through social media. Hal, there was a major announcement from the Quebec government last week with regards to health care and the plan moving forward. Christian Dubé, health minister, his big plan and his promises, hopefully for him as that government tries to get reelected. Have you looked at that plan, and does anything touch upon the type of care that people need before they even get to the hospital, the paramedic type of care?
Yeah, so they're talking about a $370 million commitment to the pre-hospital care sector over the next 5 years. They're talking about improvements to the pre-hospital care system. Unfortunately, the pre-hospital care system needs to be transformed, but hey, $370 million is still a decent chunk of change. Dubé specifically mentioned setting up a professional order for paramedics because reality check, paramedics are still not recognized as healthcare professionals. He's also talking about increasing the autonomy of practice for paramedics, which would be excellent. He's also committed to using paramedics in extended roles like community care paramedics, and that would be a phenomenal change. That would be great for the communities, for the population, and it'd be good for paramedics to be able to have lateral movement within the system. But most of all, especially for patients. So, if you have chronic care patients who could be treated at home and followed by paramedics and then referred to not necessarily an ER, possibly referred to the CLSC or a care center, that would take a huge stress load off the ERs and be great for people. Paramedics elsewhere in Canada also are involved in palliative care. And again, it's the idea of, being a force multiplier. So you get more healthcare providers out into the community in a multidisciplinary fashion, and you relieve strain on the emergency room system.
Hal, just to wrap up here and to tie it into how we started with what you just said on the plan that was unveiled by Christian Dubé and the money, the dollar signs there, why isn't there a collective bargaining agreement? Like, when you hear all of that and then you still see that they haven't had a contract for a couple of years, how do you think that all ties in together?
I'll wrap it back up to kind of the opening statement, which is I really don't understand why there's any reticence to sign with the Urgence Santé paramedics who actually work for the government. And then my other question is, why is the government negotiating with private companies? I don't understand why the private companies can't negotiate their own contracts with their paramedics and why they can't pay them properly and treat them properly the same, So if Urgence Santé is able to negotiate a contract with its paramedics, the same standards should be applied across the province. So I don't get it. I just don't understand.
Hal, listen, thanks for your insight this morning. I really do appreciate it.
All right. Take care. Thanks for having me on, Elias.
That is Hal Newman, former paramedic, firefighter, more than 4 decades of experience in emergency health services. You can read his words as he writes now for The Rover.